Hi, everybody. Welcome to Course 3. My name is Jackie Connors. I'm a nurse from St. John's, Newfoundland, with over 26 years of experience in aesthetic. I work out of the Landals Clinic in St. John's, Newfoundland, which is a dermatology-run clinic. So over the past 26 years, we put a lot of emphasis in skin quality. So hopefully after this course, you'll be a little more familiar with what the skin is, the role it has in medical aesthetics, and how important it is to consider skin quality treatments in your day-to-day clinic. So, what we're going to discuss today would be skin anatomy, factors affecting skin health, treatment modalities, patient assessment and consultation, and best practices. So first of all, skin quality. What is it? Skin quality refers to the overall health and appearance of the skin, including texture, tone, hydration, and elasticity. It is influenced by both intrinsic and extrinsic factors, which we will kind of discuss as we go along. But first, we're going to talk about skin anatomy. And as you can see from this photo, the skin is comprised of different layers and also has different nerve supply, blood supply, and also hair follicles as well. So what we'll discuss first is the epidermis, which is the outer layer of the skin, and that is our protective layer. So that layer is comprised of stratified squamous epithelium. It's avascular. It gets its nutrients from the dermis, which lies just beneath the epidermis. The main cell is the keratinocytes, but also contains melanocytes, which is responsible for the pigmentation, Langerhans cells, which provide some immunity, and then Merkel cells, which allows us to feel the touch. And as you can see, the epidermis is comprised of the stratum corneum, the stratum lucidum, the stratum granulosum, the stratum spinulosum, and then the stratum basale, which is the deeper layer of the epidermis. And then in the dermis, we have different layers as well. And the dermis actually is where most of the magic happens when we are doing a lot of our skin quality treatments. And it's the layer of the skin that provides support and strength. The function is strength, elasticity, thermoregulation, and sensory input. It's got two layers. The papillary dermis, which is the outer layer, contains loose connective tissues, capillaries, and nerve endings. And then we also have the reticular dermis, which contains dense, irregular connective tissue, sweat glands, sebaceous glands, and hair follicles. When we look at the skin, you can tell from this photo here that young skin versus aged skin is very different. And as we age, the skin does get thinner. We lose collagen and elastin, and you can see here how lines and wrinkles form and how the skin just gets thinner over time. We lose hyaluronic acid, fibroblasts, collagen, and then you can also see fat cells here too, which we do lose as we age as well. Factors affecting skin health. We talked about in the beginning here, we have extrinsic factors, we have extrinsic factors, and then we also have medical conditions and medications. When we talk about extrinsic factors, we're talking about genetics, aging, hormones, and then extrinsic, we're talking about UV exposure, pollution, smoking, diet, skincare routine as well. And then we'll get into a few medical conditions and medications, which can also affect skin quality as well. Intrinsic factors of aging. So basically, this is just chronological aging. Happens to everybody. It's kind of the biological clock. The skin is going to do different things as we age. It refers to the natural aging process, and it's influenced by genetics and internal biological factors. It typically manifests as fine lines and wrinkles due to collagen and elastin breakdown, thinning and dryness of the skin from reduced sebum production, but also decreased hyaluronic acid production as well. And then we also have loss of volume and fat redistribution. And then gradual skin laxity, which is where we get some sagging of our skin. We have extrinsic factors of aging, and these are actually factors that we really can control. So this is different things that we do in the run of a day that can also influence skin quality. And some of these would include sun exposure. Sun exposure really significantly adds to photo aging. UV radiation breaks down collagen and elastin, leading to wrinkles, pigmentation, and rough texture. We have pollution and environmental toxins, and these are like airborne pollutants which generate free radicals. They can also damage the skin and weaken the skin barrier. And then this can result in dullness, inflammation, and increased sensitivity to the skin. We have smoking, and that basically reduces blood flow, which deprives the skin of oxygen and nutrients. And then it can also lead to wrinkles, especially around the mouth, uneven skin tone, and dryness. Extrinsic factors of aging. So these would include poor nutrition. Diets high in sugar and processed foods can accelerate glycation, which does weaken collagen. Poor nutrition, which can also lead to deficiencies in vitamins A, C, E, and healthy fats, which can impair the skin repair. Alcohol consumption, which dehydrates the skin, making fine lines and dullness more prominent, increases inflammation, leading to redness and puffiness. And then chronic stress is a big one as well. It raises cortisol levels, breaking down collagen and triggering inflammation. This can worsen conditions like acne, rosacea, and eczema. And these are different medical conditions that we will discuss as well as we go along. Extrinsic factors of aging, something else that can affect this or things we can control most times, lack of sleep disrupts the skin's overnight repair process, which can lead to dark circles, puffiness, premature fine lines. It's recommended to get 7 to 9 hours of sleep per night. When we sleep, that is when our skin does most of its repairing and most of its work that it does. So lack of sleep can significantly affect how our skin looks as well. And then we also have repetitive facial movements, which contribute to dynamic wrinkles as well. Squinting, smiling can affect crow's feet, and then frowning, of course, can cause glabellar lines and wrinkles. Medical conditions affecting skin quality. So this causes negative impact skin quality by affecting the hydration levels, the elasticity, pigmentation, and overall skin barrier function. So when we talk about different medical conditions, we're referring to things like endocrine metabolic disorders like diabetes, thyroid, and polycystic ovarian syndrome. We have autoimmune and inflammatory diseases like lupus and scleroderma. We have dermatological conditions such as eczema, rosacea, vitiligo, and melasma. And then nutritional deficiencies such as vitamin C, vitamin A, iron deficiency, anemia, and zinc deficiency. And then other chronic health conditions like kidney disease, liver disease, and cardiovascular disease. So, treatment modalities. What are we referring to when we are talking about things we can do to the skin? So, we're going to talk about a few different things today, and about why each one of these are important. And typically, not one of these things will address everything, and how a combination of all of these treatments typically would be your best way to affect skin quality or improve the overall look of somebody's skin. So the first thing we're going to talk about is skincare. Skincare is important, and sometimes it's very easy we get lazy, we don't think it's important. But skincare truly is one of the first things you can do to improve the overall look of the skin. Before anybody starts any of these treatments, it is recommended to use proper skincare. It just helps kind of condition the skin, helps prepare the skin for any kind of treatments that you're about to do or to recommend to your client or your patient. Proper skincare helps to protect the skin barrier from environmental damage like sun, pollution, and free radicals. It significantly keeps the skin hydrated, and it helps it to function at its best. And it helps to prevent and manage skin issues like acne, premature aging, and hyperpigmentation. So, healthy glowing skin is about understanding what your skin needs and providing it with the right skincare consistently. So, having a morning skincare routine and a nighttime skincare routine is very, very important. Medical grade skincare. So, why is medical grade skincare important, and how is it different than what you could get at a pharmacy? Well, medical grade skin care is clinically proven. So, it's been researched, and it's got scientific studies to actually prove that it actually works. It's clinically proven, it's got high potency ingredients, which is very, very important to know. It's designed to target skin concerns at a cellular level. So when we talk about medical grade skincare, we know exactly what's in the skincare we're recommending to our patient, and also the amounts that are in skincare as well, which is very, very important. Sometimes you can read that a product at your pharmacy has vitamin C, but if you look, it could be the last ingredient on the list. So a lot of times the medical skin care is got a certain percentage of active ingredient in it, which is truly what it needs to work well. So medical grade formulations undergo rigorous testing. They have higher concentration of active ingredients, like I said, and they're often prescribed or recommended by professionals. So a lot of times, because some of these products are high in active ingredient, there's a lot of coaching that has to be done. And that's where you kind of need to understand what each ingredient is, what it does, where to place it, and also how much of this particular ingredient to put on as well. So one of the things you do have to know is, what is your patient's skin type? This is very, very important. So these are a few we're going to discuss today, and give you a few little hints on what to look for, to try and figure out what kind of skin your patient has. So dry skin, what is it? It lacks natural oils. It often feels tight, rough, or flaky. You may notice more fine lines, dullness, or a rough texture. And most people who have dry skin know they have dry skin, actually. Oily skin. I've had this my whole life. It's excess sebum production. As a result of this, you get larger pores, you have more of a tendency to have breakouts and acne, and the skin may feel greasy throughout the day, especially in the T-zone area like the forehead, nose, and chin. Normal skin has balanced sebum production with very few skin concerns. It feels comfortable throughout the day, it's not too oily or dry. Combination skin, it's a mix of oily and dry areas, typically oily in the T-zone areas and drier in the cheeks and jawline. And then a lot of what we come across in a dermatology office is people who have sensitive skin, and people who have sensitive skin are prone to irritation, redness, or reactions to certain products or environmental factors. So their skin may burn, itch, or sting when using new products. So different things in medical skincare, what you're looking for is things like retinol, which could be tretinoin, retinol. There's different names on different retinoids. And these boost collagen. They help smooth wrinkles and improve acne. Vitamin C or L-ascorbic acid, a powerful antioxidant that brightens the skin and protects from UV damage. Other skincare ingredients include HA or hyaluronic acid. This helps hydrate, plump, and straighten the skin barrier. We have things like peptides and growth factors, which stimulate collagen and help repair the skin. We have niacinamide or vitamin B3. This is an anti-inflammatory. It helps reduce redness and hyperpigmentation. And then we have hydroquinone or other brightening agents, and these help manage hyperpigmentation and melasma. Other skincare ingredients would be things like salicylic acid, and this is a BHA that helps keep the T-zone clear by penetrating deep into the pores. It's best used in areas prone to oil and congestion. Glycolic acid is an alpha hydroxy acid or an AHA that gently exfoliates and helps balance oil production while promoting even skin texture. Lactic acid is also a gentle AHA or alpha hydroxy acid that exfoliates while simultaneously hydrating. It helps to slough off dead skin cells, improve skin texture, making the skin more radiant. Ceramides, these are lipid molecules which help restore and protect the skin barrier, locking in moisture and preventing water loss. Great for keeping the skin hydrated and protected from environmental stressors. Skincare do's. Sunscreen. I think one of the most important skincare products you could ever use is sunscreen. Nobody leaves our office without one or is recommended to use one every single day. You need to hydrate your skin, a double cleanse. So what that includes is you either use the same cleanser and wash your skin twice with that same cleanser, or you may use two different cleansers. But double cleansing is important, especially if you are using different products on your skin. You want to exfoliate at least once a week, and whether that's a physical exfoliant or a chemical exfoliant, it's up to you. But it is nice to exfoliate to just get rid of that dead skin layer on the skin so that your products penetrate a little bit easier and better. You want to invest in medical grade products because we do know that these have a higher percentage of active ingredients, so that we know that they're going to work well. You want to clean your makeup brushes and pillowcase regularly. That's very, very important as well, just to help prevent any bacteria from getting into your skin. And then you also want to listen to your skin. Your skin says a lot. If it's angry, it will tell you. If it's dry, it will tell you. So you may have to change things up based on what your skin is telling you. Skincare don'ts. So sunscreen again, you don't want to skip it. So even on a cloudy day, even in the winter time, sunscreen is very, very important. You don't want to over exfoliate. That can cause to kind of some irritation and some redness to the skin. So exfoliating once a week truly is fine. You don't want to sleep with your makeup on because, like I mentioned before, sleeping is when your skin does most of its repairing and most of its work. And that's when your skincare truly makes a big difference, is at night. You don't want to pick your skin. If you have a little blemish or you have a little bump, we're all inclined to pick it and think that it's going to go away faster, but that's not true. You don't want to pick at anything. You want to just let it be. You don't want to use too many active ingredients at once. This can also lead to some kind of reaction or irritation to your skin. And one of the things you also don't want to forget is don't forget your neck and your hands. So anytime I'm putting on my skincare ingredients, I'm putting it on my face, I'm putting it down my neck, and then whatever I have left over on my hands, I'm putting it on my hands. So don't forget about those areas as well when you're using your skincare. You don't want to use expired products. So usually you will see on your skincare, there's an expiry, or it will tell you how long it's good for once it's opened. So always have a quick peek at that. And then you don't want to follow trends blindly. So, with social media now, there's all sorts of different trends that we see. Just make sure you do your homework and make sure that any trend that you may or may follow is appropriate for your skin type. And also with any treatments you're having done as well. So getting into in-office treatments, there's different things you can do. And we're going to get into these in a little more detail. But we're going to start off using injectable treatments. So why use injectables in your practice? And what are they? So they're non-invasive for the most part. They do have minimal downtime. Injectable treatments are customizable for all skin types and ages. They have long-lasting improvement in skin health, and they can easily be combined with other aesthetic treatments like lasers, microneedling, and skincare. Injectables would include hyaluronic acid skin boosters, and there's a lot of these on the market right now. How do they work? And what do they do? So they involve micro injections of non-cross-linked or lightly cross-linked HA or hyaluronic acid, which delivers deep hydration and stimulates collagen production. So you do have to know if you are adding these to your practice. One of the important things to know is it cross-linked or is it not cross-linked? Because your injection technique would be different if it is cross-linked. You will inject a little bit deeper into the skin if it is cross-linked because it can form little bumps and lumps if it's not injected properly. So make sure if you are bringing skin boosters into your practice that you know if it's cross-linked or not. It can improve skin elasticity, fine lines, and texture without adding volume. So it's a really, really nice treatment to add hydration and give a beautiful little glow to the skin. And nobody would ever know they had anything done. They still look like them, but little fine lines, wrinkles are improved, and also their skin just looks better. It looks brighter. These are best for people who have crepey skin, dehydrated skin, or fine lines, wrinkles, early signs of aging, poor skin texture. So somebody who kind of has dry, thin, crepey skin can do very well with skin boosters. Neuromodulators, why are these important? How do they work? So they help reduce the appearance of fine line and pores by decreasing oil production and sweat, leading to a smoother, more refined complexion. The biggest thing they do is they soften dynamic lines. So lines that are caused from movement, which help prevent deep wrinkles from forming. So neuromodulators like we have Botox, we have Dysport, we have Nuceiva, we have Lativo, and we have Xeomin in Canada. So all of these just kind of address lines caused by movement. And these are just shown as well to reduce facial flushing and redness by modulating the blood vessel activity. So there are some people who use or Botox or neuromodulators in their practice to address the redness that people get from rosacea or sensitive skin as well. And that's kind of a newer indication. Biostimulators, how do they work? So this is a big thing in this industry right now. They trigger neocollagenesis, which gradually improves skin thickness, elasticity, and firmness. So things like biostimulators we have in the market now would be Sculptra and Radiesse. So Sculptra stimulates type 1 collagen, leading to progressive skin tightening, and provides long-term rejuvenation. Radiesse acts as a scaffold, improving skin structure and treating crepey skin in areas like the face, neck, hands, and décolleté. Excuse me. So Sculptra is made of poly-L-lactic acid, or PLLA. And then Radiesse is made with calcium hydroxyapatite. So that they do have different ingredients in them, and they do work a little bit differently, but they do really help with increasing the collagen production in your skin. And they often involve a series of treatments as well. Plasma therapy, PRF, PRP. These are very, very popular now in a lot of clinics across the world. They use your patient-derived growth factors to enhance skin repair, collagen production, and cell regeneration. It can also improve skin texture, tone, elasticity, while reducing pigmentation and scars. It can be injected alone or in combination with microneedling for enhanced skin rejuvenation. And then offers a slower release of growth factors, making it ideal for longer lasting regenerative effects. And one of the things we found in our clinic with PRP as well is it significantly reduces downtime and increases your healing time. So we find the downtime with microneedling, for example, is a little bit less when they do add their PRP to the treatment. So different growth factors that we have, you can see here, there are different growth factors that are in our platelets, and they also just help with increasing collagen and just helping with overall skin repair. So we have PDGF, we have VEGF, we have FGF, we have EGF, and TGFB. So these are just different growth factors that are in your platelets that help with the treatment. So what is the difference in PRP and PRF? So platelet-rich plasma is the first generation platelet concentration aimed to improve tissue repair. It's got high concentration of autologous platelets suspended in a small amount of plasma. The PRP is spun at a higher speed in a centrifuge, causing larger cells to be collected at the bottom of the test tube. So what is PRF and how is it different? It's platelet-rich fibrin. It is spun at a lower speed, causes less trauma to the cell. It's got no anticoagulant in the test tube, so you are on a bit of a time crunch to inject this if you are injecting PRF. Platelet concentration that has more healing factors such as leukocytes. The clinical reason for PRF over PRP is that the growth factor concentration and platelets will be trapped in the fibrin matrix. And like I said, it must be injected quickly before coagulation occurs. And whichever company you have, they will discuss this with you in terms of how quickly the injections have to be done. So what are the clinical indications for platelet therapy? It's used a lot in orthopedic surgery, gastrointestinal surgery. I had it recently for a dental surgery, can be used in plastic surgery, and in medical aesthetics. It can be used for skin rejuvenation, hair restoration, scar revision, tissue repair, alopecia, or even hair thinning, pigmentary disorders, and lichen sclerosus. So what are the contraindications to consider if we are recommending PRP or PRF to our patient? Absolute contraindication would be any kind of platelet dysfunction syndrome, thrombocytopenia, hemodynamic instability. Do they have active anemia, septicemia, localized infection at the treatment site, or a patient unwilling to accept the risk? So relative contraindications are things that can be considered, excuse me, is things like corticosteroid injection at the treatment site within a month, systemic use of corticosteroids within 2 weeks. Have they had a recent fever or chill or any kind of infection? Cancer, especially blood or bone cancer, pregnancy or breastfeeding. We don't really recommend doing anything with pregnancy or breastfeeding in our clinic. Known platelet disorders like von Willebrand's disease, and consistent use of ASA or NSAIDs within 24 hours of procedure because it inhibits clotting. Potential adverse events would include damage to a blood vessel, temporary or permanent nerve damage that may result in pain or numbness. And that mainly comes just from your blood draw. Another potential adverse event would be infection, always a possibility when the skin integrity is impaired. So how is it done? You can inject it by hand, or we use it post microneedling, CO2 resurfacing. If you are injecting it by hand, you can use a 1 cc syringe, 30 to 33 gauge needle cannula. Excuse me. Injection should be 2 to 4 millimeter skin depth at a 45-degree angle. And then you're injecting a maximum of 0.1 to 0.2 cc's of plasma with each injection. And if you are using it with microneedling, you would just use the PRP as your glide instead of a HA serum or anything else that you may be using. So one of the new and exciting things that have come about recently is exosomes. So exosomes are something you can only add as a glide in Canada. So you can't inject exosomes, but they can be used as a glide. What are they? They are biological messengers that carry important molecules like proteins, lipids, and RNA from one cell to the other. So they're basically like little messengers. They actually kind of tell your skin what to do. They are derived from stem cells, whether that be human, plant-based, or synthetic. Stimulates collagen production, enhances skin rejuvenation, and support wound healing, reduces inflammation. Exosomes have no risk of tumor formation as they cannot replicate. They can be sterilized. They're 30 to 150 nanometers in size and can easily be absorbed by the stratum corneum to repair and rejuvenate the skin. So we use exosomes in our practice mainly as a glide for our microneedling. We do find that just like PRP, it significantly reduces the downtime. And we also think that it does kind of boost your treatment. It just gives extra growth factors and extra things to your treatment that I do think makes it better. We carry plant-based in our clinic. Human-derived exosomes are currently in a consultation period with Health Canada to determine if they should be classified as a drug or cosmetic. So for the time being, human-derived exosomes are not generally recommended at the moment. But exciting things to come, I think, with exosomes. So yeah, stay tuned. Something else we have to add to some of our treatments would be things like PDRN. It offers a biologically innovative way to enhance skin health at the cellular level. PDRN is composed of low molecular weight chains of nucleotides from DNA that are derived from salmon sperm. Polynucleotides attached to the fibroblasts stimulates them to work more efficiently, which leads to more collagen, elastin, and fibroblast production. So just like PRP and exosomes, these are just things you can add to your treatment, which significantly boosts your results, but also can decrease the downtime at the same time. So this is an exciting couple of things like PDRN and exosomes that are kind of newer in this industry, but I'm really, really excited to see where they are going to go. So THMA does offer an advanced workshop on plasma therapy, exosomes, and PDRN. So if you are interested in getting some extra education or extra training on any of these things, there is a workshop that is offered. So if you are interested, please reach out. So next, we're going to move on to energy-based treatments. We, being a dermatology clinic, have had different lasers over the years. They do work very, very well, especially combined with other treatments. So we're going to discuss just a few of them today, just so that you have an awareness and an understanding of what these treatments are. So the first thing we're going to talk about is laser resurfacing. And when we talk about laser resurfacing, we're talking about things like CO2 laser, erbium YAG laser, and Fraxel. So these devices work by stimulating fibroblasts, remodeling collagen, and resurfacing the skin. So I kind of refer to these treatments as like an eraser. It's a really, really good treatment to help smooth out fine lines and wrinkles. It helps with scarring. We do see a lot of acne scarring in our clinic, but also just generalized aging like fine lines, wrinkles, and sagging skin as well. So it improves skin texture, fine lines, pigmentation, and scars through a controlled thermal injury. So you can see from this before and after here, you can significantly improve the look of somebody's skin. There is downtime associated with any of these treatments. So, if you are thinking about doing this, make sure that you're preparing your patient appropriately. And it's often a series of treatments that are recommended with this as well. So broadband light or intense pulse light, these are basically very similar, IPL, BBL. They are wonderful treatments to add to your practice. They basically address discoloration in the skin, so redness and pigmentation, but also add to the overall look of your skin. They can decrease the size of your pores, but mainly their target is redness and pigmentation. So benefits include reduced redness, pigmentation, sun damage, overall skin clarity. We use this a lot in our clinic for rosacea. It works beautifully for just decreasing the flushing and the overall redness. Radiofrequency microneedling. This is kind of a newer laser device that we've had access to in the last few years. We're referring to things like the Morpheus 8, the Cutera Secret Pro, and Potenza. There's others out there as well. Benefits include stimulation of collagen. It tightens the skin and improves skin texture. So this is a series of treatments as well. And basically what it does, similar to microneedling, but it adds heat. So basically it can help kind of just smooth out the skin, increase collagen, and help to firm and tighten the skin as well. High intensity focused ultrasound and RF energy. We're referring to things like Ultherapy and Thermage. Benefits include deep tissue tightening through ultrasound or radiofrequency, which does produce collagen remodeling. So oftentimes these are one treatment, very little, if any, downtime, and then we have to wait 3 to 6 months for collagen remodeling to happen. So If we are doing any of these treatments in our office, we have Thermage in our office. We'll do the treatment. We'll see our patient back 3 months later, and then we'll see them back 6 months later because collagen remodeling truly does take time. And 6 months is when we know it's done most of its work. Next treatment would be microneedling or collagen induction therapy. This is a fantastic treatment. It's been around for decades. It enhances collagen production, reduces scars, improve product penetration as well. So with the microneedling, you can use different serums, you can use different boosters, you can use things like PRP, exosomes, PDRN. So there are things you can add to your microneedling treatment to basically decrease downtime, but also increase the results that your patient will get. And it's often a series. We usually recommend a series of 5 treatments in our office, done every 4 weeks, and then just a maintenance phase after that. So maybe 1 treatment every quarter, 1 treatment every 6 months. And then a jet peel. So this is something that we recently brought into our practice last year. This is a wonderful little device. It's a non-invasive procedure that's often used to combat signs of aging, dry skin, and acne. So there's different ingredients that you can add to your jet peel, and you can really customize this based on your patient's skin. It's a pressurized stream of air which penetrates into the deeper layers of your skin to deliver cleansers, serums. You can also deliver exosomes with this as well. It's gentle enough for people with sensitive skin conditions. There's no break in the skin with this at all. It's just the pressure pushes it to where it needs to go. We use jet peel for our hair rejuvenation treatments as well in our clinic, but can also be used very effectively for improving skin quality. So THMA offers an events workshop on energy-based treatments. So if you are looking for more information on any of the laser and light laser treatments out there, Tracy does a really, really good course that you can really focus and learn more about lasers and light. This is mainly just an introduction that we're doing today. So patient consultation and assessment, very, very important. Consultation. So you want to make sure you get a good medical history, current past medical conditions. Do they have eczema? Do they have rosacea? Have they had psoriasis? Have they had a history of skin cancer? That's important as well. What allergies do they have, both to medication, skincare ingredients, and any kind of allergy? It's important to capture that. Medications and supplements, including topical prescriptions, because some topical prescriptions, especially some acne treatments, can really affect what skincare treatments you're going to recommend and do. Some are recommended to stop 5-7 days before you do a procedure. So very important to make sure you ask your patient what medications and also supplements they're taking. What is their hormonal status, pregnancy, menopause, contraceptive use? Lifestyle factors, diet, hydration, sun exposure habits. Do they wear sunscreen? Do they smoke? Do they drink? Do they use recreational drugs? Sleep patterns, stress levels. I think it's an important question to ask. And then also family history, dermatological conditions. And also when we talk about family history, a lot of these treatments, you do have to capture your patient's skin type and ethnicity as well. So when you're talking about family history and trying to figure out what skin type your patient is, make sure you don't forget about asking about ethnicity as well. Consultation. What is the primary reason why they're there? What is their main goal when we are talking about skin quality treatments? Is it acne? Is it hyperpigmentation? Is it wrinkles? Is it textures? Expectations, time frames. So anytime you're doing a treatment, I think it's very important to ask, do they have anything important coming up over the next several weeks? And do they have a goal? Are they getting married? Are they traveling? Are they whatever? So very important to figure out time frame. because you're not going to want to do some of these treatments too close to a particular event. Product history, what brands do they use, what type, frequency, duration of use? Are they using any prescription medications? Are they using a retinol that they're purchasing at the drugstore, or are they using a retinol from a doctor's office? Are they using a prescription retinol? What active ingredients like retinoids, vitamin C, hydroxyacids, peptides? So very important to capture from them, what are they doing right now? What is their skincare routine? Cleansing, moisturizing, do they wear sunscreen? This is a time to really have a discussion with them about the importance of sunscreen and actually the importance of skincare in general. I'm always surprised sometimes when I ask about skincare about how many people actually do not use skincare and do not even wash their face with a cleanser. So it's a time here to kind of discuss skincare and the importance of skincare. And what other professional treatments have they had? Have they had any facials? Have they had any peels? Have they had any lasers? Have they had an injectable? So it's very important to know what they've had, how long ago they've had it. Do they have something coming up in the future? So important to capture these things as well. Skin assessment. So you're going to want to look at them. You're also going to want to feel their skin. So you want to make sure you have appropriate lighting, any diagnostic tools. We have this really cool camera in our office called a Vizia, and basically it can take different photos of the skin. It can help us distinguish whether they're oily, dry, and the overall conditions of their skin. So it just basically helps to diagnose, but also to recommend certain treatments. What skin type are they? So we talked about this a few minutes ago on the Fitzpatrick scale. Are they a 1, 2, 3, 4, 5? Some people with higher Fitzpatrick skin scales cannot have certain treatments done, particularly certain lasers. So very important to know your Fitzpatrick scale. Skin condition, hydration, elasticity, tone, oiliness. Do they have sensitive, reactive skin? Do they have any lesions or irregularities? Any moles, scars, hyperpigmentation, broken capillaries? Very important to take photos before any of your treatments as well, because sometimes it's important to capture things that were there prior to treatment starting. Signs of aging. Do they have any creepy skin? Do they have any fine lines? Do they have any volumes? Do they have any sagging skin? So all of these things are important to consider when we're doing our skin assessment. And then treatment plan, skincare plan, personalize it to your patient, recommend product sequence and frequency. I also educate them on why I'm recommending certain products to them and why they need to be used in a certain time frame and how much of it they need to use. And then suggested in-clinic treatments, timeline, frequency, and if they are using any active ingredients like retinol, sometimes it's recommended to stop that retinol before you do a certain procedure. So in the skincare plan, make sure you discuss all of those things. Set measurable goals. I think very important to set realistic expectations. Tell them collagen remodeling takes time. It can take up to 6 months for it to happen. Review dates with them, timing of appointments, frequency of appointments, discuss that with them. Provide written and digital aftercare instructions. So we always give them a handout with pre-treatment as well as post-care treatment instructions as well. So best practices, any device that you bring into your clinic, you want to make sure that it's Health Canada approved. You want to develop policies for each device and also policies on how to perform the procedure. You want to obtain informed consent for any treatments that they're having at your office. Document assessment findings, products and procedures recommended, clients' decisions and signed consent forms. photograph before treatment with consent, of course. And we also photograph in between treatments as well. So we don't do it before every treatment, but we may do it, say, once every second or third treatment, just so that you can assess their improvement. It's good for you when you're learning, but also it's good for them to see the improvement in their skin as well. It's very easy to forget how your skin looked before you did any kind of treatment or even before you use any kind of skincare. So photographs, very, very important. You want to schedule check-in appointments to monitor their progress. So we actually do this if somebody starts on new skincare as well. We monitor their progress. We may get them back 6 weeks later. We may get them back 3 months later. Do you have any questions? Is there any problems? And we take photos as well. You may have to adjust your treatment plan and for whatever reason, maybe they had a flare up of their acne, maybe they started a new prescription cream. So you may have to adjust the plan. So make sure every treatment they come in, you're getting a good history. Has anything changed? Are you using anything new on your skin? Have you had anything done to your skin recently? So all those things are very, very important. And you want to reinforce home care compliance. So especially with some laser treatments, there are some at-home treatments that we recommend you do. So make sure that you're reminding them after each treatment as well as to the do's and don'ts. So to summarize this today, personalized protocols combining injectables, device-based treatments, medical care, skincare provide superior long-term improvements. So like I said in the beginning, it's often a combination of all these treatments that provide the best results. So don't be afraid to recommend combined treatments. And these are just a few of the skincare quality treatments that we talked about today. There are others as well. But these I feel were the most popular and certainly some of the most common treatments that are out there. You want to provide patient education on maintenance treatments and lifestyle factors to ensure lasting results. So you have to reinforce the importance of maintenance treatments. You have to enforce the use of sun avoidance and sunscreen. If they're coming in and you're improving, getting rid of some of their sun damage, it's important to maintain that result. So the use of skincare and sunscreen is important. Combination therapies like neuromodulators, skin boosters, RF microneedling, all of these combined enhance overall skin rejuvenation. So don't be afraid to come up with a treatment plan that includes all or some of these skincare quality treatments. So thank you. I appreciate your time today. If there's any questions at all, we're always here to help. If you wanted to reach out to me personally, if you had any questions, please feel free. I am on Instagram, Jackie_nurse injector, or my email is jackieconnors437@gmail.com. So thank you very much for your time today. I hope you learned something, and I look forward to seeing you all soon. So thank you very much. Bye.